Hello, it's Bruce Williams again, and today I'd like to do part 6 in my series on selected gross pathology of the eye, in which we're going to talk about a number of miscellaneous diseases of the eye and the orbit, starting with the iris and go back. The corneal lesions were covered in the previous lecture. As I do at the beginning of all of my lectures, I want to thank a number of individuals who have made their images available to me through online collections or directly, and have allowed me to make these lectures for you. Here's an absolutely wonderful image from the Animal Eye Institute, which kicks off a discussion of synechia in the eye. Synechia is the attachment generally of the iris either to the cornea, which is called an anterior synechia, or to the surface of the lens, which is called a posterior synechia. In this cat, there has been a 360-degree adhesion from the iris backwards to the surface of the lens, resulting in a billowing forth of the iris, which is known as iris Bombay. Remember that the normal drainage of the aqueous is such that it comes out of the vitreous into the anterior segment and goes out through the trabecular meshwork. If that is occluded by this type of synechia and there's no way for it to get out of the vitreous, the pressure in the vitreous increases and it pushes forward on the attached iris, causing this apparent bulging in the anterior chamber. As we'll see in the next two slides, when pressure from the vitreous causes the iris to bow forward, it is the final nail in the coffin, resulting in blockage of the angle and the trabecular meshwork. Here's another picture from the Animal Eye Institute showing a displaced lens, also known as ectopia lentis. This is mostly seen in dogs, it's rarely seen in cats. And in this picture, the entire lens is displaced toward the lateral limbus, and you can see the edge of the lens, which you should not see, and you can actually see the zonular fibers, which anchor the lens in place and attach to the ciliary body. This is something that even though the animal's eye is widely dilated, you should not be seeing. Changes in the position of the lens may be congenital or acquired. Many of the acquired forms are due to blunt trauma. There is a genetic issue in middle-aged terrier dogs, especially Tibetan terriers, which have a genetic predisposition to bilateral zonular fiber rupture and displacement of the lens. It's thought to be caused by a mutation in the Adams T17 gene, which codes for a metalloproteinase that's important in the remodeling of structural matrix proteins, including those involved in the formulation and maintenance of these lens zonular fibers. When we see a cross-section of an anterior displacement of the lens, and you can see here that the lens is right up against the cornea, it shows a couple of things going on in this particular lens in its position in relation to the vitreous and the aqueous. Remember, we said that if you block the drainage angle, the entire vitreous would move forward and you would get a nice bowing forward of the iris. Well, that's what's happening here. This lens is migrated into the anterior chamber. We have blocked the drainage angle in a circumferential fashion. So the aqueous, which normally comes from the vitreous and out through the drainage angle, has nowhere to go. The vitreous itself is swollen, and on either side of the lens, it is pushing forward on the iris and further blocking the drainage angle, which is right here. So we have a couple of things that are occluding drainage, both the abnormal position of the lens and the swelling of the vitreous, and this is an eye that was doomed. Lenses may shift forward. They may also shift backwards in this lovely picture by Dr. Stephanie Schrader, or they can shift from side to side. But whenever they get out of position, they're going to cause problems in the eye. Well, now that we are talking about the lens, it's time to talk about a couple of very common changes that we see in older animals in many species. It's important to understand a couple of facts about the lens. As opposed to the cornea, which is lined on both sides by epithelium, but the stroma is composed of fibrocytes, the lens is a completely epithelial structure. The viable epithelial cells, or the germinal epithelial cells, are present on the anterior and posterior surfaces of the lens, just underneath the lens capsule. As they reproduce, older cells go to the center of the lens. So the cells in the center of the lens are the oldest ones in the lens itself. As the normal time passes, the normal clear proteins of these lens epithelial cells become somewhat desiccated and crystalline in nature, and they do not pass light as well as the newer cells at the periphery of the lens. This change is called lenticular sclerosis, and it's common in dogs older than 7 years, once again occurring from the progressive aging and the compression put on older lens epithelial cells now in the center of the lens. It gives sort of a whitish blue appearance to the lens, although you can still see the tapetal or the fundic reflection, which is one difference from a cataract. But in the early stages of cataract formation, it is extremely difficult to determine, at least grossly, what is acceptable for nuclear sclerosis and what is actual incipient cataract formation. As a reminder, we covered in the 3rd or 4th lecture the condition known as diabetic cataracts, where high glucose levels in the aqueous humor will overwhelm the Embden-Meyerhof pathway, which is the way that lens epithelial cells are able to phosphorylate ATP through anaerobic glycolysis. And you will get an accumulation of sorbitol within the lens. Water will enter these fibers, they'll swell, and you'll also get cataract formation. As ocular pathology comes with its own vocabulary, let's review a couple of different terms that you'll hear when we talk about cataracts. I already mentioned the incipient cataract. Incipient cataracts involve less than 15% of the lens. And these are the ones that can be very difficult in middle-aged animals to tell from lenticular sclerosis. Immature cataracts affect more than 15% of the lens, but lens involvement is incomplete, and they don't completely obscure the fundic reflection. Mature cataracts will affect the entire lens, and you will no longer be able to see the fundic reflection in the back of the eye. Over time, these crystallized proteins within the lens that cause the obscuring effect of the cataract will break down, and not in a totally diffuse fashion. So you'll see areas of clearing and areas of obscuration, as we see in these dogs' cataracts. And these are known as hypermature cataracts. If you look at a hypermature cataract that is on a histologic section, you will see some very characteristic changes. including ruptured lens fibers and extrusion of protein, which organize into globules known as Morgagnian globules. And you'll also see that the lens capsule is somewhat undulant because the lens is not as large as it used to be. It's lost some volume. And these are associated with hypermature cataracts. As the lens starts to break down, that lens capsule may leak protein into the rest of the globe, resulting in inflammation because normally the body never sees it, and this is known as phacolytic uveitis. Cataracts may be inherited, and over 100 different canine breeds have been identified with a genetic predisposition for cataracts. Staffordshire and Boston Terriers are well known for early onset cataract development. Cataracts may also develop following significant inflammatory disease in the eye, but the majority are probably idiopathic. People also develop cataracts over time, and they're rarely the result of a single insult, but usually assumed to represent years of accumulated and perhaps synergistic insults to the eye, including genetics, environment, and dietary causes. We see cataracts in a wide range of species. Here's one in a horse. Another little bit of terminology that you will hear in association with cataract formation are the terms cortical cataracts and subcapsular cataracts. And these generally refer to the location of the opacified lens fibers. Cortical cataracts result in a diffuse opacification of the lens fibers as seen in this particular specimen. Subcapsular cataracts result in the opacification and metaplasia of those lens epithelial cells, those progenitor cells that are underneath the capsule on the anterior and posterior surface that give rise to the rest of the fibers of the lens. And so subcapsular cataracts generally just affect those particular areas. As we look at the cataracts in this gerbil as an example of the many species that get cataracts, let's review a couple things about the lens that's important in cataract formation. And if you're interested in ocular pathology, you need to remember. The lens is a transparent, cellular but avascular structure which gets all of its nourishment by absorbing glucose from the aqueous humor. It is surrounded by a basement membrane which is secreted by the epithelial cells immediately subjacent, which also divide to form all of the epithelial lens fibers. The lens is composed of approximately 65% water and 35% protein. And the transparency of those lens fibers is maintained by a number of factors, including low cytoplasmic density or a lack of intracellular organelles, and the highly organized lattice arrangement of the fibers themselves. When we look at the lens fibers, their protein component is approximately 90% soluble crystallins and about 10% insoluble proteins or albuminoids within the cell membrane and the nucleus. And then over time, those balances will shift, and we will have less soluble protein and more insoluble proteins as the lens fibers begin to progressively opacify, either as a result of age or cataract formation. Here's an inbred mouse with cataracts, and mice have long been used in cataract research. In the early days, high levels of radiation, especially ultraviolet radiation or hyperbaric oxygen, were used to cause them so we could study how to treat them. Today, those particular methods are no longer used as a number of transgenic mice strains have been developed which spontaneously and rapidly develop cataracts. Many of these models for progressive cataract formation are characterized by mutations in the beta-crystalline encoding genes. This is a great picture from Dr. Dean Percy of a rat with hypermature cataracts. And most of us know about retinal changes that are associated with high levels of light, also known as the top cage model, because animals that live in the top cages close to the light sources in laboratory research colonies have long been known to have degenerative changes because they get much more light than the animals in the bottom. As a matter of fact, anything over an intensity of about 130 lux will result in this change. It also does damage to the lens as well, and most of these animals will have incipient or even stronger cataract formation as a result of high levels of light in their eyes all the time. This change doesn't happen to animals with a pigmented uveal tract. It is much more commonly seen in white rats and white mice, which have very low levels of pigment in their uvea. In addition to light intensity and ultraviolet radiation, other forms of radiation have been incriminated in the development of cataracts. Negative voltage X radiation for cancer therapy, especially in and around the head, has been shown to help to develop progressive cataracts, especially in dogs. Up to 30% of dogs getting radiation for nasal carcinoma may have evidence of cataract formation as a byproduct of that radiation. Nutritional deficiencies may also result in cataract formation. In fish, a number of dietary deficiencies have been associated with cataracts, including sulfur-containing amino acid deficiencies, zinc deficiencies, and vitamin C deficiency. Remember that fish are one of the many species, along with primates, certain types of birds, who cannot manufacture vitamin C on their own, and one of the manifestations of deficiency of this vitamin is cataract formation in fish. This is a young New Zealand white rabbit, probably less than 6 months of age, or not too much older, with unilateral, probably bilateral buphthalmia and increased intraocular pressure. This is a genetic problem seen in this particular type of rabbit within the first 6 months, and it's the result of underdevelopment of the outflow channels of the eye and impaired anterior chamber drainage because there has been incomplete cleavage of the iridocorneal angle. These animals don't show a lot of pain, probably only because they're young, and during this period of their development, that sclera is pretty stretchy, but you can also see that there is corneal edema, which obscures a nice view of the pupil, even though they exhibit little discomfort. They don't usually respond to any type of management, and this condition is an inherited autosomal recessive defect of the BU/BU, or the boo-boo gene. I think it stands for buphthalmia. This genetic abnormality has incomplete penetrance, so some animals that are homozygous for this particular gene abnormality may show no disease, but the heterozygotes generally will manifest with the condition. Here is an Akita dog with bilateral anterior uveitis and depigmentation of the skin of the nose with a condition known as uveodermatologic syndrome or Voigt-Koyanagi-Harada syndrome. This is a condition that is also seen in people. And interestingly, both the human and the canine disease is most prevalent in people and dogs of Asian extraction. So we see these in Akitas and Shiba Inus and dogs who are considered to have been developed in the Far East. This is an autoimmune disease which is a potently destructive granulomatous endophthalmitis, as the macrophages of the body turn against the pigmented cells in the eyes and the skin. The retinal pigmented epithelium appears to be the most susceptible and probably the initial target, but soon this inflammatory disease affects all of the pigmented structures of the eye, including the retina itself, the choroid, and the uveal tract, resulting in, at least visually, a severe anterior uveitis. In areas of pigment loss, you can also see a change in the color of the hair, or leukotrichia, as well. It's difficult to pick up around the nose because generally they're white there, but there is inflammation and a change in the color of the hair around the eyes as well. Eye lesions tend to appear before the cutaneous lesions. Maybe that's just because they are easier for the owners to pick up. But generally, eye lesions will develop first. Histologically, you will see severe granulomatous endophthalmitis affecting almost every part of the eye, and there will often be retinal detachment in severely affected eyes. Most cases that you'll look at histologically will have very chronic lesions, and these animals will be heavily treated. So there is no classic textbook lesion for this eye except for diffuse granulomatous inflammation. Here's another animal with bilateral severe anterior uveitis due to Voigt-Korenaga-Harada syndrome. And just a couple of other notes. This is probably a T-cell mediated autoimmune process, as the T cells prime the macrophages to attack pigmented cells. Affected animals may also show production of anti-retinal antibodies due to the retinal inflammation. This particularly wide-eyed golden retriever mix has a disease that has primarily been identified in golden retrievers and some other large breed dogs. It goes by a number of names, including lymphocytic extraorbital myositis or just orbital myositis, but it's a specific syndrome of inflammation affecting the extraocular muscles of these breeds. While the histologic changes are identical to immune-mediated masticatory myositis, the inflammatory picture shows interstitial lymphocytic myositis, and antibodies against type 2 muscle fibers have been demonstrated. It has never been associated with either masticatory myositis or polymyositis. It is a very specific condition which simply affects the extraocular muscles. In affected golden retrievers, they are usually young dogs between the age of 6 to 18 months who have recently undergone some stressful activity. The clinical presentation is characteristic because there's exophthalmos, or bulging of the eye and retraction of the upper eyelids, but there is no protrusion of the third eyelid in the affected animals. The condition is similar to Graves' disease in humans, and CD3 positive lymphocytes predominate. Histologically, in these two pictures are for Dr. Jim Carpenter, formerly of Angel Memorial Animal Hospital. The extraocular muscles are swollen, and these white bands are composed of innumerable infiltrating lymphocytes and degenerate myofibers. Let's look at a couple of diseases of the orbit itself. Protrusion of the nictitating membrane and the gland of the third eyelid is a common finding in dogs, and is thought to reflect a congenital laxity in the connective tissue anchoring the gland to the cartilage of the third eyelid. As the lacrimal gland of the third eyelid contributes significantly to the tear film, surgical excision for a cosmetic appearance is generally contraindicated in most cases. Here's a guinea pig with a similar appearance, except it's not the third eyelid, it's just some of the conjunctival fat that has protruded and is visible. This is a common problem in guinea pigs, which is known as PI, that's PEA-EYE, by guinea pig fanciers. Usually not glandular tissue, just a little bit of fat in the conjunctiva, and can be surgically removed without any detriment to the eye. This is an uncommon presentation of a conjunctivitis that is rare in the dog and is very similar to a similar condition in people. It's known as Ligneous Conjunctivitis. Ligneous being from the Latin word for wood. This is thought to result from an inherited plasminogen deficiency. So the animals have trouble breaking down fibrin. And you get these large accumulations of fibrin not only around the conjunctiva, but they can also be seen in the oral cavity, nasopharynx, trachea, and pericardium as well. And it's not only fibrin, but it also is poorly organized granulation tissue, probably subsequent to the continued production of fibrin in the overlaying layers of the conjunctiva. This is a condition that is often seen in Dobermans and Golden Retrievers, and histologically presents as a conjunctival biopsy with an adherent pseudomembranous exudate, which is cell poor, and the fibrin appears as a hyaline matrix with occasional epithelial elements embedded deeply in the matrix. These cases are rare, and you may not ever come across one. And the link to a plasminogen deficiency has only been reported in one Golden Retriever. So the books are still open on this one. This is a condition which is seen often in pet rabbits, known as a pseudopterygium. This results from a circumferential infolding of the bulbar conjunctiva, which closes over the unaffected cornea. It's usually unilateral, doesn't have any signs of pain, and this conjunctiva is not anchored to the underlying cornea, so there is no inflammation. It's also been called a corneal conjunctival membrane. These can be surgically removed, but often will regrow following surgical excision. Here's an angry-looking cat, but he's not so much angry as he has Horner syndrome, which represents damage to the sympathetic innervation of the eye. The classic signs of Horner syndrome are enophthalmos, or a withdrawal of the eye, so the eye has a narrow palpebral fissure, as you can see here, miosis, or constriction of the pupil, and protrusion of the third eyelid. It may be associated with otitis media and is more commonly seen in cats than dogs. Remember that postganglionic neuronal axons pass through the tympanic bulla along the ventral surface of the petrous temporal bone, so infection in this area may cause neuritis and the signs that we see here. There is actually a syndrome that is the complete opposite called Porphyre du Petit syndrome, in which you get hyperactivity of these same postganglionic sympathetic neurons. So you get the opposite change. You get mydriasis or pupil dilation, widening of the palpebral fissure with bulging. But this Porphyre du Petit syndrome is a very, very rare occurrence. And Horner syndrome is much more commonly seen in cats with otitis media and dogs as well. It's interesting that cats look angry when they have Horner syndrome. Dogs just look a little bit drunk. Well, that brings us to the end of this lecture. We have one more lecture in this series. Lecture 7 will cover neoplasms of the eye. I hope you'll come back and view that one as well, and that you've enjoyed this lecture. Please frequently visit the Foundation's Facebook page and our YouTube channel as we post more lectures, not only that I've produced, but lectures from our meetings. We have a great one going on today in Perugia with more ocular pathology, and this afternoon our Senior Vice President, Dr. Fabio Del Piero, will be talking on small animal gastrointestinal pathology. The lectures from that meeting will be uploaded to a playlist on the Foundation's YouTube channel, where you can see those and many of the other lectures that we are producing for you. Thanks for your attention and have a great day.